You've worked hard for what you have. Your money, your assets, your 401k, and home. Isn't it all worth protecting? Nearly 1 in 4 consumers have been a victim of identity theft. LifeLock Ultimate Plus helps protect your finances with up to $3 million in reimbursement. LifeLock alerts you to identity threats you might miss. And if your identity is stolen, your dedicated U.S.-based restoration specialist will work to fix it. Let LifeLock help protect what you've worked so hard for. Save 25% off your first year on LifeLock Ultimate Plus at LifeLock.com/aware. Terms apply.
Welcome to the Attention Deficit Disorder Expert Podcast Series by Attitude Magazine.
I'm Wayne Callan, and you're listening to Attitude Magazine's weekly ADHD Expert broadcast. Today's webinar is sponsored by Fast Forward, the original brain training intervention for reading problems and the only one proven by research at Stanford, MIT, and Harvard. With Fast Forward and a remote tutor, you will see changes in your child's reading within 2 months. To learn more about Fast Forward, visit their website, www.scilearn, that's SCILEARN.com/ADD. I don't know about you folks, but it seems like whenever I read or talk about ADHD these days, I always get around to the topic of executive functions. Yet a lot of us are confused about EFs, as they are called. Parents and adults, for instance, with ADHD write us every week, wondering, can you have executive function problems without having ADHD? Does a normal ADHD evaluation pick up executive function problems? How high is the correlation between ADHD and EFs? How do you improve your executive functions? If you are a little foggy about EFs, today's webinar will be of great interest to you. We will finally get a clear, precise definition of EFs, how they relate to ADHD, how strong emotions and frustration, which often come along with attention deficit, affect EFs, and how we go about improving executive function so we can live a more productive life. Today we're very fortunate to have Thomas Brown with us. Dr. Brown is an assistant clinical professor of psychiatry at the Yale University School of Medicine and Associate Director of the Yale Clinic for Attention and Related Disorders. He is the author of the book Smart But Stuck, Emotions in Teens and Adults with ADHD, A New Understanding of ADHD in Children and Adults, and ADHD Comorbidities, Handbook for ADHD Complications in Children and Adults. So with that introduction, let me turn it over to Tom. And thanks, Tom, again for being here.
Thank you, Wayne. I'm glad to be here, and thank you to all who've tuned in. What I'd like to talk with you about today is, as Wayne suggested, an area where there's been some confusion about ADHD and what executive functions means. And I'd like to try and clarify that a little bit, and then talk about where we are in trying to learn more about it. I think most everybody understands that this disorder, which we call ADD or ADHD, I tend to use those two terms interchangeably, has been around for a long time. But from the time it was first written up in 1902 up until about 1980, it was all about little kids who couldn't sit still and wouldn't shut up and were just driving everybody nuts. Since that time, there's been a lot more research done, and we've gotten much more clarification about it. And now I think it's fair to say that most people working in the field would agree that we can see ADHD as with an equation that says ADHD equals developmental impairment of the brain's management system, its executive functions. And what do we mean by that, by developmental impairment? What we mean is that some aspects of the brain's self-management system, which is another term for executive functions, just don't come online in the usual time frame as they would for other kids or adults of the same age. And they tend not to work as consistently. But we'll talk more about that as we go along. So the question is, what are we talking about? When we use that term executive functions, what does it mean? It's a way of talking about a wide range of central control processes of the brain that serve to connect and to prioritize and to integrate our cognitive functions for us moment by moment. The metaphor that I've found helpful for thinking about this is if you picture a symphony orchestra where all the musicians are really good at playing their instruments, regardless of how good they may be, if you don't have a conductor who can select what they're going to play and get each musician to play his or her specific part of the same piece at the same time, and we can keep them on time so that they can adjust the volume and the speed and organize them and start them and stop them. Without a good conductor, you're not going to get very good music out of a symphony. And what we're talking about when we're talking about executive functions are those functions which might be referred to as the conductor of the brain's symphony. But of course, there's no little man inside the head that's actually conducting things. What we're really talking about when we use the term executive functions is a network of networks of neural connections within the brain that help us to be able to manage what we need to do from day to day. Muriel Lisak, a very prominent neuropsychologist, was talking about this, and she said, the question that executive functions really address is the question of, will you do it? How are you going to do it? And when are you going to get around to it? And I think if you look at the components here, you can see pretty much what the issues are. With the will you do it, that has to do with issues of motivation and getting started, activation, that are critical for people with ADHD. How will you do it? That gets into planning and organizing and prioritizing and being able to make decisions about sort of when you get started on one thing and when you stop doing that and go on to something else that you need to do. We all have to make decisions about prioritizing what we're going to pay attention to and what we're going to spend our time and effort on all the time. And then the when part of it is, when the hell are you going to get around to it? Can you estimate how much time you've got to be able to do this in a reasonably accurate way? And then can you remember what it is you are going to do and keep in mind what you're intending to do, while at the same time keeping in the back of your mind some other things that you may also need to be keeping in mind as you're doing it. So let's get into this a little bit more. But before I do, I think it is important to understand that though we talk about these executive functions as though there are separate things, and we can identify, I'm going to be talking about different clusters of them, this is not all about one thing. For example, often when we talk about ADHD or ADD, we talk about it as a problem with focus. Well, that's true, but we're not talking about inattention now as not focused in, like being able to hold the camera still so you can take a picture of something that's not moving. I think a better way of understanding what kind of focus we're talking about when we're discussing focus of the mind and its executive functions is focus on your driving. Think about what you do when you're driving a car. You're not gluing your eyes to the bumper of the car in front of you. You're watching what they're doing, but you're also noticing that the stoplight down the street is beginning to change from green to red, and you're getting your foot off the accelerator and over toward the brake. You're also noticing what's coming up behind you on your rear view mirror and your side view mirror. You're paying attention to the fact that there's a large truck backing out of the driveway right into the path that you're trying to travel. You're noticing that there are a few pedestrians running across the street. You're thinking about how you need to shift to get over into the left lane because you're going to want to make a turn at the next corner. And while you're doing that, you might also be thinking about what you're going to purchase when you get to the grocery store. Now, what are we doing when we're focusing on our driving in that way? What we're doing is we're noticing some things and ignoring some other things that aren't really relevant right now. And we're holding in mind, in working memory, briefly, while what we just saw in the mirror, what we just noticed coming across the street or coming out of the driveway. And then we're progressively discarding the things we don't need to hold on to, while at the same time picking up other things that are going on and keeping in mind the goal, safely driving the car to get to the grocery store. It's that kind of focus where we're depending upon our ability to hold focus and shift focus, often very quickly, and then refocus in terms of whatever's coming up, and then utilizing working memory to hold on to these things we need to remember, and then to discard the things that we don't want to remember, because we can't pay attention to everything all at the same time. So we're talking about that process. And you might ask yourself, okay, well, what tasks are there? What things that we do really involve executive functions anyhow? Well, I think one way of putting it would be to say that it's the tasks we have to do that involve managing oneself. We have to prioritize and decide, okay, what are we going to do first? We have to get ourselves started. We have to sustain our efforts and keep at it in order to finish the task. Sometimes we have to shift tasks from one thing to another, or from one phase of the task to another. Other times we've got to stop ourselves, and at the same time, we've got to integrate these cognitive functions. And when we're talking about executive function, what we're talking about is when a person has to manage these things for oneself. And the difference would be, for example, if you've got a young kid, there is a stage when you're trying to help the child learn how to get himself or herself dressed. And you say, okay, now put on your underpants. No, let's put underpants first, then you put on your pants, you put on your jeans. Okay, now get on your shoes, and you don't put the shoes on until after you've got your socks on. And where you're not providing that moment by moment, simple step by step directions, you're having the person utilize their memory of how to do it or how to figure it out as you go. And when you move from that point where you have to walk the person through it, and you're really providing the scaffolding to allow them to do it, to the point where they can get themselves dressed in the morning, or they're able to prepare their own peanut butter and jelly sandwich, or cook a meal, or cross the street safely, or know how to answer the phone, and then you move up to increasingly complex tasks where you can do these things without somebody whispering in your ear, now do this, now do that. Those are the tasks which require executive function. Obviously, they're very different from one age level to another, one grade in school to another, and they're very different when one becomes an adolescent, and even more when you move on into adulthood. But we've all got our own executive functions. Now, this diagram that you can see on this slide is a model I've been working with for a number of years. And people sometimes ask me, well, where'd you get that? I got it by listening to patients. I'm a clinician. And I treat little kids, I treat teenagers, I treat adults. And in the process of seeing a very large number of children and teenagers and adults, most of them with ADHD, many of them with other things along with it, I've listened as they've explained to me what kinds of things were difficult for them. And in that way, I was able gradually to get some sense of what problems are common for people who have ADHD. And so what you see here in these little boxes is an effort to put these into clumps, into clusters. And it's that whole half dozen clusters that I'm proposing as a way of thinking about executive functions. It's not the only way. There are other people who have different models, and sometimes the words are a little different and so forth. But let me just say some things about this one. First of all, if you'll notice down on the bottom, those little boxes, they're like titles: activation, focus, effort, emotion, memory, and action. Those are not labels which mean that everything in the box above it is all the same. You might think of them instead as more, this is not like height or weight or blood pressure, where it's all one thing and you have more or less of it. It's more like these are, think of them as baskets of related cognitive functions. And so activation has to do with things that are about getting organized, things that are prioritizing, and then being able to get started on things. Focus is not only talking about focusing in the narrow sense, but also on being able to shift focus when you need to, as well as being able to keep up the focus when you need to. Regulating alertness has to do with sleep, and we're going to talk about each one of these things as we go. But as you look along this list, you see that there's more than one thing referred to in the box, and that there are many networks in the brain that are making these things happen. The second thing I think is important to know about it is that most of the things that we do, whether it's a matter of getting dressed in the morning and getting out the door to go to school or to work or wherever, or preparing a meal, or doing homework, or doing our job, that most of these tasks that require some executive function involve not just one, but a number of these different clusters. And then there's a third point that I think is very often neglected in the field, and that is most of these things happen unconsciously. And I'm not talking about unconscious here in the psychoanalytic sense of repressed memories. I'm thinking about it as the more modern sense of unconscious, as in automaticity. That they happen so fast, and as to be automatic. That one does not stop and think about it any more than a basketball player who's charging in to do a layup shot thinks, now I move my left foot forward, now I move my right foot forward, now I drop my shoulder, and so forth. They are integrated, and they are very quickly put together by us when we're carrying on a conversation, when we're walking through a crowded mall, when we're organizing ourselves to clean our room or clean the house or drive the car or ride a bike or cross the street. So those are the three things I'd say about it, that these are, each one represents a combination of various networks in the brain that help to carry on these functions. They interact with one another to do most of the tasks that we have to do that depend on executive function, and that they operate for the most part unconsciously in that sense of automaticity. So I'm going to take just a couple of minutes to talk a little bit about what's involved in each of these. I don't have time to go into great detail about them because the fact is that there's just not that much time, and I have published things like this, and you can find out more information on my website or in my publications. But organizing and prioritizing is sort of figuring out, okay, well, how soon do I have to do this? I've got three things I'm thinking about doing now. Which one should I do first? Can't do them all at once. And then it's also getting past that point of procrastination. So there's some things here that have to do with organizing. Often people with ADD have trouble organizing their stuff, but often a bigger problem is organizing their time. Whether it's a matter of, okay, I've got a certain amount of time I can do homework tonight, which things do I need to do, what's due tomorrow, and which is most important for me. But there's also a matter of, in addition to estimating time and then prioritizing them sensibly, it's important to be able to get started. And one of the things that most people with ADD will tell you is that they have a lot of trouble with procrastination, that they tend to put things off until the last minute. It's almost as though they can't get interested in it until it's becoming an emergency. But being able to organize and then prioritize and get started, that's one cluster of this. Now, I mentioned focus before, and this is not just a matter of being able to listen when somebody's talking to you, it's also a matter of being able to stick to a task without getting too distracted either by something that's going on in one's own head or by noises or actions that are going around. It's like if you're doing something online, it means being able to stick to what you're trying to do and not have one thing lead you to another, where pretty soon you've spent about an hour and a half looking up interesting things online that you didn't really need to look up, and in the process you haven't gotten started on the one thing you had to do. And remember, the distractions come not just from what's around us, but also from our own thoughts and our responses to what's going on around us. But I'd like to take a moment to talk about the implications of this for reading. Because one of the things that I hear about a lot from people with ADHD is that they have a lot of trouble with their reading. Not so much that they can't read. Many of them are very good readers in terms of being able to fluently read the words on the page. But there is a problem that comes up a lot with people who have ADD in their reading, and that is if what they're reading is something that is not so interesting to them, it's very hard for them to get engaged with the text. And so I'm talking now not about the kind of magazine article or newspaper article or book that a person might pick up and read because they're really, really interested in what that's talking about. No, I'm talking about not the self-selected reading. I'm talking about assigned reading, things that one has to read because of what the homework assignment is or what you're being asked to read for a course in school, or things that one has to read on the job, where you really don't have much personal interest in this. It's not all that interesting, but you have to read it. Well, you just have to get the thing read. People with ADD often will say there's a huge difference between how they read when it's something that they are interested in and how they read when it's just assigned and they're not interested in it. I had one college student who said to me one time, when I'm trying to read something that's assigned to me, which I have no interest in, it's almost as though I'm licking the words and I'm not chewing them. And he went on to explain that what he meant by that was that as he reads, he understands exactly what the words mean. It's not that he can't derive the meaning of the words, but the problem is that he's not engaged with the text enough that he can remember it. And so often people with ADHD with that sort of difficulty will read something, they'll read several pages, and they understand it perfectly well at the moment that they read it. And then they get a few pages into it and stop for a second and realize their eyes have gone over every word. They understood it all as they were reading it, and now they do not have the foggiest idea of what they just read. And so they got to go back and read it again if they're going to be able to remember it, to carry on a conversation or a discussion about it, or to be able to answer questions in school. So it's that kind of being able to focus and then shift attention when you need to and then pay attention, but in an actively engaged way. And you can see the way that it's a problem with people who have ADHD when it's a matter if they're not interested in it. And that's actually, something which I'd like to take a moment separate from this slide to emphasize. The great mystery of ADHD to most people is, how is it that somebody who has this can pay attention so well for a few things in which they're really interested, something they want to read or something they want to do, when for almost everything else they've got to do, they've got a lot of difficulty in being able to get organized, get started, being able to focus and hold the focus. It's that variation from one circumstance to the other. I've seen thousands of people with ADHD, little kids, teenagers, and adults. Every single one of them has had a few things they can do where they have no trouble paying attention and getting engaged with the task and working well on it, even though in almost everything else they've got a lot of trouble paying attention. For some, it's a sport that they get involved in playing. For others, it's doing video games. For others, it's making art or making music or doing woodworking or mechanical tasks or preparing meals. And those things they can do very well, those that they're particularly interested in, even though in almost everything else they've got a lot of trouble exercising those same skills, these very things we're talking about, which are executive functions. Now, some other things that you might not think about including in notions of executive function is regulating sleep and alertness. Many people with ADD report they've got a lot of trouble in being able to get to sleep at night. They'll say, I stay up a lot later than I really want to or should, because I found if I try to go to bed before I'm really, really tired, I just can't shut my head off. I just keep thinking of stuff. But then once they do fall asleep, they tend to sleep like dead people, and they often have a lot of trouble getting themselves up in the morning, regardless of how long they've been sleeping. During the day, they're usually okay if they're on their feet moving around or talking to somebody, but if they have to sit still for very long to listen or to read or do paperwork, often their eyelids get pretty heavy. But it's not just a matter of regulating alertness, being able to wake up when you need to wake up and get to sleep when you need to get to sleep. It's also sustaining effort. I had a university student who came in one day and he said, he was a track star, runner. He came in and said, my mind is a great sprinter, but it's a lousy distance runner. If the task I'm trying to do is something you do quickly in one chunk and you just go all out for it and then you're done with it, I'm fine. But it's something where you can't do in one quick chunk. It's a longer-term project. You have to keep chipping away at it day after day. He said, that I have a lot more trouble with. And my approach then is either hurry up, slapdash, get the damn thing done. Let's not worry too much about quality control here. Or why don't we just set this aside and wait until it becomes more of an emergency? And there's something else, too, about processing speed, which we use to talk about how fast does the brain process information. And the place that I hear that most is people with ADHD often report that they have a lot of trouble when they're writing. It's not true for everybody with ADD, but many of them will say, when I have to write an email, or when I have to write an essay, or when I have to write a term paper for school, or a report for work, I can have good ideas about what to write, but it takes me forever to get the sentences and paragraphs out on the page. And often they will struggle and find it takes way longer than most other people to be able to get that task done. And it's all part of processing speed, which is related to alertness and also sustaining effort. The next executive function cluster that I'm talking about is one that is not related to the DSM-4 or 5 criteria at all. There's nothing in the DSM, even the DSM-5, the most recent one, that has anything to do with emotion. But the fact is there are a number of us who do research in this field who are saying, hey, this is some area that really is a problem for people with ADHD, and it's a problem with executive functions. Why? Because very often people with ADHD have difficulties in managing their emotions. And the way I'm talking about it here is it speaks about managing frustration, which is one good example of it, but also modulating emotions of other kinds. And here's the way that works, that we think about it as being able to impose what we call top-down control. Many times we think about emotions. This is not literally how things are operating in the body and the brain, but we think about emotions as being sort of built in, that there's some people who in early infancy are very quick to startle and will jump when there's a loud noise way more than even a baby of the same age would. Or there are other people who find that they get so frustrated easily. Other people get angry easily. And those are sort of the bottom-up things that you can see in a very young child in infancy, long before they can walk, that there are differences in temperament. And what we learn as we get a little bit older is to be able to modulate those emotions that come up, anger, irritation, hurts, desires, worries, and be able to modulate them so they don't take over too much of what we're thinking or doing. And the reality is that a lot of folks with ADD report that they have a lot of chronic difficulty in managing at least some of those emotions. And they don't seem to have as much ability as most others of the same age to put the lid on it. To be able to respond to the feelings that are involved, not to sweep them under the rug, but to be able to do that without having it take over their whole mind and what they're thinking about, as though it's a computer virus invading the hard drive of a computer. So managing frustration, modulating emotions, another important executive function. And then we have also the importance of monitoring and self-regulating action. And, for years, everybody has spoken about the fact that many people with ADHD, not all of them, but many of them, tend to be kind of impulsive. This is like shoot first and then aim later. There's a kind of impulsiveness in doing. It's the kid who reaches out and grabs something without knowing whether it's safe to grab it or not, or who crosses the street without bothering to look both ways to see if there's anything coming that could be a danger. That kind of impulsivity, the kind of person that just sort of speaks out as though they have no filter and often says things that are embarrassing to them or hurtful to other people without thinking about it. But there's also controlling actions, being able to slow down when one needs to slow down and speed up as you need to for tasks. There are many kids, for example, in school who think that they operate at least as though the prize is going to go to the one who gets finished first rather than the one who has the best answers. And so by monitoring and self-regulating action, what we're talking about is that measure of self-control that allows allows one to sort of monitor the situation and then, modify one's actions to fit the situation and what you're trying to do. So it's these 6 clusters that I'm using to describe executive function. And what we know is that these things are not all present when we're born. We have the capacity to learn them, but the fact is they don't all appear in early childhood. And we know that as we raise our kids and teach in schools and set up curriculums and so forth. There are different things you expect as somebody gets a little older. The ability to exercise these executive functions is not fully developed even in middle childhood. These cognitive functions are among the slowest aspects of the brain to develop, and they're not fully matured in most people until late teens, early 20s. Now, the current diagnostic criteria for ADHD say that if we're going to make a diagnosis, we're supposed to have evidence that at least some of these symptoms have been present in the person since before their age 12. It used to be age 7. Well, that may be a little better than what we had before, but there are many of us who think it's a mistake to have an age of onset at all for this disorder, just as there is none for depression or for anxiety, because there are some folks who function very well in early childhood, especially as high IQ folks with ADHD. And a lot of those people will come in and say, I was an honors student when I was in elementary school, junior high, I was having a little more trouble as I moved from having one teacher most of the day to having to relate to several different teachers. And then when I went to high school, things got more complicated. There's a lot more homework. I had to manage more for myself. And that's when things began to deteriorate. So sometimes you don't see this by even age 12. For some people, the impairments of executive function do not become obvious until they get into mid to late adolescence and sometimes well into adulthood. And the analogy I use for thinking about that is if you put somebody on a table and you do an electrocardiogram with them while they're lying still, they may look perfectly good in that EKG. But if you put them then on a treadmill and increase the resistance while they're trying to walk or run on that treadmill, you may see occlusion of arteries that you couldn't see while they were getting the EKG done lying down. That when the additional stress is imposed on the system, then you begin to see the difficulties. And in the same way with executive functions, there are some people where you can see it in preschool, but there are some people where it does not become obvious until high school and sometimes even beyond that. And there's increasing information these days about midlife onset of ADHD. So what can we say? I think I just pushed too fast. Sorry about that. I hit the wrong button. And now I've gone too far backwards. So my point here is that these executive functions develop gradually, and they're not always noticeable by age 12. But let me talk a little bit about just a couple more things here related to, there are two different views of ADHD and how it's related to executive function. And this is still a bit of a controversy in the field. There are some people who say, oh, executive function, I know what that is. It's how you do on tests of executive function in the psychologist's office. There are some tests which are done in the psychologist's office that are sort of looking at these pictures and sort them in the words according to whether they're the key color is the word or the word that's being spoken, or trail making, or the card sorting tests, and some computer models and tests and so forth. And if you use those tests, which are done in a psychologist's office, and which I think of as not very realistic in terms of what real life involves, about a third of people with ADHD score poorly on those tests. And so those people who are using that notion of ADHD and executive functions would say, well, executive functions are like a comorbidity. It's something else that goes with ADHD in the same way that sometimes depression goes with it or anxiety goes with it. But there's a different view, and Russell Barkley and I have both argued that you can't measure executive functions with these so-called tests of executive functions that neuropsychologists give, that those tests are too artificial. They're not ecologically valid. They're not enough like normal life. And that really, when we're talking about executive function, what we want to know is, how does a person function day by day in the things they have to do at school and in work and in getting along with other people? And so we need to measure it across time. And that's why we depend on normed rating scales that where we can compare how things are for the person in a variety of situations, day after day, week after week, month after month, for at least the past 6 months, and usually much longer. And so we talk with people. The best evaluating instrument we've got for ADHD is a well-conducted clinical interview that asks the right questions and knows how to sort out what looks like ADD, and also the normed rating scales that we have for asking about a whole variety of executive function impairments. And if you take that definition, that we're going to measure it not by tests, neuropsychological tests, but by rating scale data and interviews about the person's daily life, 100% of those with ADHD are impaired on those measures. That's what it is to have ADHD. The diagnostic criteria that are in the DSM pick up some of it, but particularly for adults, they don't pick up enough of it. That's why we've got to get more information. So this brings me back to the point that I was starting with, that I think we can say is still a little controversial, but not all that much, that ADHD equals developmental impairment of the executive functions of the brain. And that by developmental impairment, we mean not developing as you'd expect for somebody of that particular age. So these are some books that I have published which give information about some of these ideas, but I'm going to stop now and invite questions.
Well, we have plenty of them, Tom. A lot of good ones. Several on, are there any ADHD medications that actually help executive functions?
Any of the medications that are approved for the treatment of ADHD tend to help executive function impairments, because that's what it means. Getting organized, getting started, being able to utilize short-term working memory, being able to regulate alertness, those are exactly the kinds of things. It's not as though the DSM criteria are completely off base. They pick up part of it. They just don't pick up all the ways in which this is manifest, particularly in adulthood. So my answer to that question would be that the medications which we use typically for treatment of ADHD are used to treat symptoms of executive function impairment. Now, do they work with everybody? No. I generally tell patients that your chances of the medication working to alleviate your ADD symptoms are about 8 for 10. Now, for some people, in that 8, it's huge how much it helps them. Others, it's substantial but not huge. Others, it helps a little but not that much. And 2 out of 10, it doesn't do a damn thing. So yes, these medicines work. Then they don't work equally well for all people, and they certainly don't work equally well for every one of the executive functions I've described. But generally, if it's going to help with one, it's going to help with most of them. And for many people, it can be quite helpful.
Mm-hmm. Can executive function be taught either through brain training, technology, books, counseling? A lot of people have asked that. They want to know how to improve it.
If a person is really impaired in their executive functioning, quite a bit more than most others of the same age, then that would usually qualify for an ADHD diagnosis. And the most effective treatment we have for ADHD is medication. It does not work, as I just said, for everybody. 8 for 10 are good odds as long as you're in the 8. Now, there are some people who think that you can improve all this by simply telling people what they ought to do. And I think that's overly optimistic, because the reality is that while there are certainly some people who need some help in learning how efficiently to do their job, whether they're being a student or in learning how to take notes and how to organize your notebooks and how to study effectively and so forth, those things we can teach. But people who are impaired in their working memory, people who are impaired in their ability to organize and prioritize and these other difficulties of executive function, and given the fact that these are unconsciously operating, they're not likely to be able to change them a lot. Many of the patients I see know very well what they ought to be doing. They just can't get themselves to do it. And some of these things that are advertised, some of these computer train your brain programs and various nutritional supplements and so forth that are offered online, the scientific evidence to support them as ways of improving executive function, parenthesis, ADHD, close parenthesis, is really pretty shoddy. You get a lot of enthusiastic reports from the people who are evaluating if they are the people who are helping to do the program. Like if you've got parents who are making the kid use a particular computer program to presumably train their brain, they'll tell you that it's working well, but if you have blinded evaluations with people who don't have an investment in that treatment program of working with that particular diet program or that particular computer training program, the results are really quite lame. The scientific evidence is not good for lasting effects. And some of the computer programs, you can practice them enough and you get very good at playing the kind of skills that are involved in those computer programs, but they don't generalize. They don't carry over into other things when you're looking at well-designed scientific studies.
Mm-hmm. A lot of questions about working memory. Is working memory impaired in all people with ADHD?
Yes. Working memory is probably the biggest problem that people with ADHD have as a rule. It's not the only problem, but working memory is very important. But you need to ask yourself, working memory for what? Because, for example, there are some people, first of all, let me clarify one thing. If you ask people with ADD, how's your memory? Often they say, well, I've got the best memory in my family. I can remember stuff nobody else can remember. And they give you some example about how they saw a movie 10 years ago and they can tell you the entire storyline of the movie without any details being left out. Or somebody else will say, well, yeah, I can tell you the batting averages for all the guys on the baseball team that I'm following. Or I could describe all the plays they ran in the Super Bowl 2 years ago when I saw it. But even though they might be really good about remembering some things like that from a long time ago, if you ask them about something that happened just a few minutes ago, often they can't tell you. The problems with memory with ADHD are with working memory and being able to hold one thing in mind while doing something else. Some people are very good at remembering numbers, but they have a lot of trouble remembering what they've just heard in a conversation. Some people can do a little better with remembering the words, but they can't remember the numbers, particularly if they have to turn them down. For example, if you call the information operator up to get a phone number and you have to hold it in your head while you dial it because you have no piece of paper to write it down on, that's often hard for a lot of people with ADHD because they start transposing the digits. But there's some other people who can remember phone numbers easily, but they cannot remember what they were just asked to do when they were going upstairs. And while you're up there, would you please bring down your sneakers and also grab a new box of Kleenex. So there are various ways that working memory gets challenged, but there are significant impairments with working memory in virtually everybody with ADHD, although not always in the same domains.
There are a fair number of people asking questions about, they're feeling a little despair here. They would like to know, I mean, you mentioned medication, but what would be a practical, productive treatment plan for people with EF challenges?
Well, when we're talking about medicine, the important thing to know is that the fine-tuning on the medicines we use most often are the stimulants because those are the ones we've had the longest and we've got the most research on them and they tend to work the best. But what a lot of people do not understand is that while there are some medicines that can be prescribed according to how old you are or how much you weigh, that is not true of the stimulants. That the amount of medication that's going to be effective for helping people alleviate their ADHD/EF problems has nothing to do with how old they are, how much they weigh, or how severe the symptoms are. It's how sensitive is your body to it. I see little kids, I see teenagers, I see adults. Most of the little kids are taking very small doses. But there are a few of them, just as small as all the rest of them, not many, but a few, where we've got to go to the top of the adult dosing range to touch them because their bodies are not that sensitive to it. And for them, that works very well, even though for most other kids, that'd be way too much. And among the adults I see, most of them are taking very hefty doses, but there are some of them taller and fatter than I am, and I'm not skinny, and who respond very well to a dose that's no more than you give a typical 5-year-old. So the fine-tuning of the medicine to get it in that sweet spot between too little and too much is critical, and a lot of prescribers are not onto that about the stimulants because it's quite different from many other medications. So that is the first thing that I usually think of is you get the chemistry straight. Now, it doesn't work for everybody. But then these if you once you get that done, then hopefully they're going to be better able to learn some of the things, because the pills are not going to create the skills. And if they didn't quite get how to do some of the things they need to do, they may need some tutorial work. They might need somebody else to help them as a coach or a parent or a friend to help them learn how to do some of these things. It's not that the medicine fixes everything. But if the problem is basically with the body chemistry, as it is with ADHD, then most people are not going to respond unless you can straighten it very well, unless you can straighten out the body chemistry.
I think you might have touched on this already, but I have to ask this again because there are so many people asking. So there are no non-medication approaches to improving EFs as far as you can see, other than the coaching, which is a strong therapy. But I'm just saying.
If you've got a good coach, the coaching can be helpful, and remedial tutoring can be helpful. People can learn some skills about how to organize themselves and so forth, because there are some people where the medicines simply do not work. 8 out of 10 are good odds, but it still leaves 20% where the medicines we have right now are not that effective. But people learn to compensate. And the other thing to keep in mind is it also, when you talk about impairment, you always have to ask for what. And there are some people who really struggle a lot when they're in school. But then when they get out of school, they're fortunate enough to find work where they can build on their strengths and avoid some of those things that are particularly difficult for them. And sometimes you can make adjustments in, particularly as you get into the latter years of high school and if people are going into college, to try to get a fit between the person's strengths and what they're trying to do. I have many people who struggled through school when they had to do a little bit of everything, but then once they got into the point where they could major in something where they've got some interest, they're able to manage quite well. And there are many people with ADD who are extremely competent people for doing a lot of things, but they often need some help in being able, either from medicine or from having a good secretary or a good partner to help them out, to deal with some of the ADHD stuff that may not adequately be managed by medication.
I think I know the answer to this, but there are a fair number of people asking, can you outgrow EF challenges? I would imagine you can.
That is sometimes. Sometimes.
Okay.
About something around 30% of people, depending on how you measure it, who have ADHD as kids do find that these abilities improve. I see a number of people, for example, who flunked out of college their first year and then went back a couple of years later and were honor students. Now, what's that about? Sometimes it's because they stopped getting high every day or drinking way too much or missing classes, but other times they didn't have those problems when they were in school, but the problem was that their executive function capacities had not matured. Research done by Shaw and some others over recent years has shown us that if you compare a group of students or of kids who have ADHD with a group of kids of the same age who don't have ADHD, and then you watch them over the course of their growing up from early to middle childhood into adolescence, you see a process in most of the kids who don't have ADHD where the capacity for doing these executive functions gradually is improving. And as I said, it doesn't mature for most people until late teens, early 20s. But what they found in Phil Shaw's study is that among those kids whom they were comparing who had ADHD, on average, they were about 3 years behind in the development of those. Most of the areas of the brain matured at the same rate. Let me emphasize that. But there are a few parts of the brain that are particularly important for executive function where there was a typical delay of about 3 years, sometimes a little more, sometimes a little less. And so I think that helps to explain the fact that there are some people who it takes them a little longer. It really is a developmental lag. But that when those capacities mature, they often are able to function as well as anybody else.
No, that's encouraging. Are there any gender-related differences in executive functions? Do boys seem to have the challenges more, boys and men more than girls and women? I mean, several people have asked that.
Well, there certainly are a lot more boys. It's usually about 2.5 or 3 to 1 in terms of boys versus girls identified. But that's usually because the boys, as a group, not all of them, but as a group, they tend to be a little bit more impulsive and make a little more trouble for parents and teachers as they're growing up. And the girls, some of them can be just as much a pain in the neck as the boys are in terms of their behavior with ADHD during childhood and school years. But the fact is that not as many. And so the girls, since they don't make as much trouble for their parents and teachers when they're younger, they often get missed. Just as some of the kids who have no behavior problems don't usually get picked up until later in their school career. Mm-hmm. But the fact is that when you're looking at executive functions that are characteristic of ADHD, the ratios in terms of women and older girls being identified, if you look in the clinics around the world that are treating ADHD in adults, what you find is that the ratios are not 2.5 or 3 to 1 in favor of males. It's almost 1 to 1. That there are more girls and women who are able to get identified as having ADHD when they're old enough to bring themselves in for consultation and not get dragged in by parents who are frustrated because they're not cooperating enough, the kid's not cooperating enough in school. Mm-hmm. And there's another thing that our group has worked on recently, and that is for women, there are many women who function quite well during their childhood, adolescence, and early adult years, including some who are very well educated, very competent professional and businesswomen, who, when they have menopause and the estrogen level drops down, tend to experience midlife onset of difficulties with these executive functions. We just published a paper about that a year ago, which is on my website. Mm-hmm. And we find that for those women, sometimes the treatments that we use for ADHD have been proven helpful. It's not officially approved by the FDA at this point for that indication, but it's an onset of something which is very much like an ADHD that didn't emerge for them until midlife.
Mm-hmm. So I guess, what is the best way to get professionally evaluated for EF challenges, or is it just, I guess what I'm asking is the ADHD evaluation and diagnosis the same, or are there tests that go beyond the ADHD to test for executive function challenges?
I would say a well-developed, a well-done clinical interview and normed rating scale with the things that need normally to be included in a good clinical interview for ADHD should be enough to pick it up, because those rating scales, particularly the newer ones for adults, are going to be picking it up, because it's not as though the DSM criteria are completely separate from executive function. They pick up some of those executive functions. They just do not ask about them specifically enough, particularly for adults, which is not surprising since the criteria for ADHD diagnosis are based on field studies of kids from aged 4 to 17. The issue here is you need somebody who really knows what ADHD looks like and how to tell the difference between that and other possible problems, and who can also sort out the fact that there are other things that often accompany. That we all know that people with ADHD have a higher risk, 6 times the risk if you look at them in the middle of adulthood, of having at least one other psychiatric or learning disorder at some time in their lives. Mm-hmm. But it's not, to go and get tests of executive function, that's getting into that neuropsychological test battery. Those are good tools if you're trying to look for a tumor or a stroke, or a brain tumor or stroke damage. But they are not good tools for assessing ADHD. I've seen people who have paid thousands of dollars for neuropsychological evaluations that did not even include an ADHD rating scale. They completely missed the diagnosis. So it's a matter of finding a skilled enough clinician who has some experience and special interest in ADHD enough to be able to sort that out. And I would say that a good ADHD evaluation is going to be picking up executive functions, because that's basically what ADHD is. Let me also say there is no separate diagnosis for executive function. You'll find terms like dysexecutive problems or so forth, but those are not diagnostic categories that will be recognized on a diagnosis for an insurance company, for example. ADHD is, this is the argument I'm trying to make, that ADHD is developmental impairment of executive function. That's what it is. And you don't go looking for some separate test. You're looking for somebody who understands, has a modern, scientifically based understanding of ADHD. And if you do that and they don't limit themselves too strictly to just the DSM-5 criteria, that should pick it up.
Mm-hmm. This will probably be the last question, Tom, but since you brought up normed rating scales, people want specifics. What should they be looking for? What should their clinician be using? Could you mention a few names?
Yeah, there are several different rating scales that are published and that are in pretty wide use. These go beyond the DSM criteria to ask about many more specific things. And there are rating scales that Keith Connors has published for all age groups, that Russell Barkley has published for all age groups, that I've published for all age groups. And it's important, again, when it's age-based, age-normed. So it's related to the age group you're looking at. And then also is the brief behavioral rating inventory of executive function. There's the CIFA that Jack Naglieri and Sam Goldstein have put out.
How do you spell CIFA?
CIFI.
Okay.
Comprehensive interviews of executive function interviews. Comprehensive evaluation inventory of executive functions, or something like that.
Okay.
But these are you want one that's actually normed, not just something you get out of a magazine. They can be very helpful, but you need norms rating scales if you're going to assess them, and you need a clinician who doesn't just count numbers of symptoms, but who also can ask the follow-up questions to be sure you're all talking about the same thing.
Well, we'll have to leave it there, Tom. That was great. Thanks so much for your insights and strategies. I know I'm much clearer about things.
Good. Well, thank you very much for having me.
Yeah, thanks again for coming. And once again, the webinar was sponsored by Fast Forward, the original brain training intervention for reading problems, and the only one proven by research at Stanford, MIT, and Harvard. With Fast Forward and a remote tutor, you will see changes in your child's reading within 2 months. To learn more about Fast Forward, visit their website, www.scilearn.com/ADD. That's SCI Learn, LEARN. And we're grateful for all of you listening in. Have a good day, everyone.
For more Attitude podcasts and information on living well with attention deficit, visit attitudemag.com. That's ADDITUDEMAG.com.